Today we're going to talk about 상급골수술, which, oh my god, in English that means double eyelid surgery.
Lower blepharoplasty surgery to remove my under eye bags.
Generally, I just wanted to have a crease that was even on both sides, a little bit more prominent, and won't disappear on me.
First, my eyelids were completely numb.
The bleph was a quick, I want to say 45 minutes maybe. I was completely numb. I could kind of feel little things that they were doing, but it didn't hurt at all. It was quick and done.
I just got my stitches out and they are looking so good.
It makes me look so much more awake.
The surgery was $10,000 for all 3 procedures.
Non-incisional was around $800 to $900, and I believe incisional was $2,000 to $2,200.
It lasts about 5 to 10 years, depending on the person, and some people it lasts longer.
Today we're talking about eyelid surgery, upper bleph, lower bleph, double eyelid surgery, under eye bags, recovery, all of it. Basically the parts that never make it into the 15-second reveal videos. Online, the stuff looks quick and clean. Snap your fingers, wake up looking rested. And for some people, that's close to true. But once you actually sit with these stories, you hear about the swelling that takes forever to go down, the bruising, the numbness, dry eyes, scars, one side healing faster than the other. And honestly, the shock of realizing a small procedure this close to your face can knock you sideways emotionally.
We are getting these eye bags removed. I've had them since I was a kid. I remember when I was in, let's say, 1st or 2nd grade, my dad actually took me to an allergist because he was like, why does my child have under eye bags? Like, that's insane. So he took me to the allergist and they're like, oh yeah, I think she just has like allergies and like that's like a symptom of them. We're going to put her on a Claritin regimen. So for, I want to say like a year or so, I was on a Claritin regimen as a kid every morning, getting up for school, taking a Claritin and sending me off on my way. And it didn't help, obviously. They are genetic. That is the thing about under eye bags. There's nothing you can do about them.
All right, so we're officially 2 weeks post-op of my lower bleph. As you can see, this eye is a little bit irritated this morning. Usually when I wake up, it is. I have pretty minimal scarring on each side. We're not even close to being like fully healed up or anything like that. So I think with the progress that it's been so far, I think we'll be looking pretty good. The ones up here are still raised, as you can see. I'm hoping when I go to my appointment on Thursday that the swelling on this eye is down enough since my last visit that she's not going to need to do those stitches to close up my eye for 2 weeks. Yesterday was my last day on my steroids. I was on them for 6 days. The steroids help with the swelling. And I would definitely say, even though it is still swollen, that the steroids have helped reduce it about 50%. Like if you look at my one of my last videos, because I haven't really been updating lately, and look at the swelling from then till now. Before, you couldn't really even like see any of the, well, I shouldn't say see any of the color. It was it was like covering this much of my eye, and now it's down to there. So I think it's like, it definitely helped, and I'm hoping that it helped enough that she's not going to have to stitch my eye shut.
This is day A. I do get headaches. I do feel like pressure and stiffness. Like that feels really weird. Today they're really red. I see a little bit more bruising, especially under my eyes. Swelling went down a lot, but the redness and the stitching still looks scary. But you can see they're starting to heal and turning into like scabs. I've been doing really well with my antibiotics and pain medication and heat compress now. It feels like a lot of pressure, kind of like a sinus infection. Yeah, today just feels like pressure, like around my eyes.
Painless. I didn't have any pain. I mean, the most I've had is like a little bit of pressure because I am swollen in my nasal fold right here and a little bit of a headache, but as far as pain, none. 2, I have been so lethargic. Like, I feel like I'm a toddler taking naps during the day. It's like I'll go 3 or 4 hours and then I'll do like a 30-minute nap on the couch. So I'm just really tired, honestly, but I had surgery, so I did not have anesthesia, so I can't really blame it on that, but I had a lot of pain pills, anxiety meds. Number 3, just the swelling. I wasn't really, definitely lots of swelling. Oh, and a lot of drainage. I've had so much drainage from this eye. I have bloody tears, and just like every morning it's waking me up with some kind of drainage. And I'm sure it's because obviously I'm swelling. That swelling and fluid has to go somewhere.
What stands out first is how personal this area of the face is. Everyone's reason is different. Some people go in for an upper bluff because they've got extra skin hanging over the lid. Some just feel like their eyelids make them look permanently tired. A few said they'd been raising their eyebrows all day just to see properly, which gave them tension headaches for years. Others wanted eye makeup to actually sit right, or just wanted to look awake for once. And there's a whole separate group getting lower bluff for under eye bags they've had since they were kids. Genetic, not lifestyle. That distinction matters. This isn't always about wanting to look like someone else. A lot of the time it's about looking like you feel rested, awake, present. One woman said she'd had under eye bags since childhood, so bad her parents took her to an allergist because they assumed it was allergies. It wasn't. It was just how her face was built. And that's the reality for some people with under eye bags. You can sleep 8 hours, drink your water, slather on eye cream, get filler, layer concealer, and still see them. Because it was never—
I'm about 8 days out from a lower lid blepharoplasty. Here's what we're looking like. I also got CO2 on my neck that's healing still. This is some tinted SPF, by the way. I got a lower lid bleph to address eye bags. So instead of having like an under eye hollow, I've always had a bag. They're genetic. What I've learned is there's 3 fat pads under your eyes and mine were just too full. I have before gotten filler, not in my tear trough, but to erase this shadow that would occur right here basically. So it's almost like upper cheek filler. Definitely like a band-aid for the problem, and a lower bleph is really the only way to get rid of under eye bags. So we did a lower bleph and then we did a peel. This is my second lower lid bleph. The first one I got was 10 years ago when I was 21. The first time I went, I got the procedure done by a plastic surgeon. It was literally such a horrific recovery. I was bleeding from the eyes for weeks. I was swollen for weeks. For the first 24 hours, I couldn't even like open my eyes. They were literally crusted closed. So this last surgery I got was with Dr. Verchek in Dallas. Dr. Verchek is an oculoplastic surgeon and he does upper bluffs too and like other eye stuff. I definitely think going to an oculoplastic surgeon, I fear was like common sense, but the first time I just like, it was so long ago. And I was referred to my initial doctor, so I went and trusted him and it just wasn't the best. Dr. Verchek said there was actually some scar tissue left over from the first one, and they also left fat in my face. Because I was 21 and just like so young, he didn't really know how I was going to age and he didn't want to take too much fat out in that initial surgery. My face definitely slimmed down throughout my 20s, but that under eye fat just like didn't. I'm already pretty satisfied with the results considering like this is how puffy my eyes would be with like mild allergies, and I still have so much swelling.
Before getting an upper blepharoplasty, here is the before. You can see all this extra skin on my eyelids, and I'm super insecure about it. It's all I can see in pictures. This is the picture I sent in to the doctor. You can see like how much it hangs over throughout the day.
I am now home from my upper blepharoplasty. You can see it's been a few hours. It's really black and blue, obviously, and really swollen. Day 2 upper blepharoplasty surgery progress. Swelling has gone down, still obviously very black and blue. Day 3 upper blepharoplasty progress update. The swelling has gone down significantly, so has the bruising. This side is still much more swollen than this side, and I was able to leave my house today. I went and got lunch with my friends. So day 4 update on my upper blepharoplasty surgery. The bruising has gone down significantly, and I was able to wash my hair. We're on day 5 and it's looking so good. I feel like the bruising has gone down significantly. Day 7 upper blepharoplasty update, and I am ready for this to be over. It's looking good. I'm feeling good. Day 8 of upper blepharoplasty surgery recovery. It's looking good. I'm feeling good. I get my stitches out tomorrow. I'm so freaking excited. I just got my stitches out and they are looking so good. I'm feeling like myself. Just knowing they're not in there, I feel like I'm a new person. It is the day after I got my stitches out and things are looking so good. You can definitely see the scar, but I really anticipate it to fade. Yes, I'm wearing the same shirt as yesterday. I put it on to walk the dog. And I still have some bruising. You can also see where the stitches came out. And I'm feeling good. I'm so happy with the results.
About 5 hours post-op from my awake upper blepharoplasty, which is just the like an upper eyelid lift, whatever you want to call it. We take the droopy skin and cut it out. We recorded the entire thing, so if you want to see that, stay tuned. I'm going to put that together. But really, you know, they put some sedation under your tongue. You don't feel any pain. It's really, you guys, it was so easy. I'm not feeling any pain now. I took a couple Tylenol. Obviously some bruising and swelling. The first set of sutures are going to come out in 2 days. We'll record that as well. And then in a week, the rest come out. But 10 out of 10, I would do it again. And this is what we look like 26, 27 hours afterwards. I think I may have laid too flat last night and I ended up with a lot of swelling here. You can see that. I'm like, my eyes barely closed and they definitely don't open wide. But, zero pain. Took a couple of Tylenols just so I don't end up in pain today. And that's about it. Dr. Pena's going to come in tomorrow and take out my first set of stitches. And then we're good. We're good to go. Yeah, I'll keep you guys updated. But anyone who's considering this procedure, do it. And do it awake because I have zero complaints.
Okay, you guys, so this is day 7 of my upper blepharoplasty, and I had the beauty filter on, but it looks really good, right?
But this is also exactly where expectations need to be in check. Your eyes aren't like a hair color you can change and forget. They sit at the center of your face, so even a small shift changes how you read to people, including yourself. Some women got precisely the result they wanted and still needed weeks to feel normal looking in a mirror. One said nobody around her even noticed a difference, but she felt completely different. Which tracks? A change can be invisible to everyone else and still feel massive to the person who has to live behind that face every day. Middle 2. Here's something that came up again and again. The surgery itself wasn't the hard part. Most of these women described numbness, pressure, some stiffness, maybe mild tenderness, not real pain. Several were awake for it. Others were sedated enough that the whole thing is a blur. More than one said an upper bleph was easier than surgeries they'd had before. Recovery is where it gets complicated.
It's officially been 3 months since I got my upper blepharoplasty, and here is the update. Like I mentioned in another video, I am a super slow healer, and I looked busted for like a good month. Now things are looking pretty good, but I'm still actually swollen, and I'll show you a close-up of my lids. First thing to note is that this eye is healing faster than this eye. You can see it when I open my eyes. When I actually press on the suture area, this side is nice and flat, but this side is flat here and then still a little swollen right in this area. I'm seeing my doctor in a couple weeks, and she mentioned last time that she may need to do like a little steroid injection there, but we'll see. I'll update you guys. Over the next 3 months, I'm expecting for the lids to shrink down even more. The reason I think that is because my lids, like this part, is actually still pretty puffy on both sides, this side being more puffy than this side. And please excuse my fingernail. The thing that people don't tell you is that the lids actually go numb after you get the surgery done. And this side is way more numb than this side still.
It has been 4 months since I got an upper blepharoplasty, and I wanted to show you guys my progress pictures so far. Here is my before picture. Looked tired all the time. This was me getting a lot of Botox to try to lift that part of my face. This is where I'm at currently. Don't have any Botox lifting my eyes at all. It makes me look so much more awake. A year and a half before I actually ended up getting the procedure done. I asked her if I was ready for a lower bleph, and she was like, absolutely not. It's gonna make you look insane. She's like, you are a good candidate for your top lid. So I just was gonna trust her. I'm really happy with the results. Here is me immediately after. This was where I was like, oh shoot, I think I might have messed up here. I'm very fair skinned and also a redhead, so I bruise very, very easily. So this is just kind of a normal reaction for me. I know other women that have gotten this done and they haven't bruised as much as I did. Surgery is a very personal thing. You never really know how you're gonna react until you're in the moment. So this photo is from day 3. Day 3 was when I was like, oh, okay, I see the vision. I see where we're going. This was when I got my stitches out and I flew back to New York this day. So this is no makeup on. Instead of getting an incision that went down, my surgeon did an incision that went up. So you can still see that on the outer part of my eyelid, I still have a scar that is recovering from that. So here's my eyes closed. It did make like everything kind of purple and a little discolored around my eyes. I'm doing little massages very gently and then also applying a scar cream, silicone scar cream every morning and every night. You can't really tell if I have concealer on. I did have a lot of dry eye post-op because your eyes are so swollen and tight from the procedure. Your eyes are used to having a bit more lid skin to close. And so when you remove that lid skin, your eyes have to relearn where they meet, I guess, if that makes sense. I ended up getting punctal plugs put into my little tear duct here to help with lubrication. That's like a huge tip.
I'm 4 weeks post-op today. No, look. What is this? I literally cannot even believe my eyes are that bad. What is that? I look about 80. So this is your sign to get upper blepharoplasty if it's been something on your list to do. I cannot believe I waited this long to do it. What is going on, please?
Day 3, 4, and 5 of my lower lip, I was swollen like a pumpkin. I looked so crazy. And I started to think, what if the results don't come out like I want them to? But I think if you start to try to deviate too far away from your natural face and the anatomy of your face, like naturally my eyes are a little bit more sunken into my head. It's never going to be like completely flat under my eyes, because even if you look at pictures of me when I was a baby, and sometimes I will even look closely at other people's eyes, like just to see, how it looks. And, sometimes you just have those lines under there because that's your anatomy.
Even a painless surgery can produce a healing process that looks alarming: bruising, swelling, redness, stitches, scabbing, deep purple discoloration, drainage, tears tinged with blood, headaches, pressure behind the eyes. It's enough to make anyone stare in the mirror and think they've made a huge mistake. That's the part nobody prepares you for emotionally. No pain doesn't mean no fear. You can feel completely fine and still look like you got in a fight. And because it's your face, that mismatch messes with your head. One woman said day 3 was when she finally started seeing the results she'd signed up for. That timeline matters. In the first few days, you're not looking at the outcome, you're looking at trauma still working itself out. But try telling that to your brain at 2 a.m. when you're inspecting your reflection, asking if this is normal, if it'll settle, if they took too much, too little, why one eye looks further along than the other. Patience turns out to be most of the job.
3 months ago, I controversially got my eyelids done. I went to Nana Plastic Surgery in Gangnam, South Korea. I researched a couple of places and had some consultations, and Nana made me feel very understood and comfortable. The clinic is super clean and organized. On the consultation day, I asked for a doctor that specialized in eyelid surgery. I did go with Dr. Kwan because I had less fat on my eyelids and I didn't want a super dramatic difference. We decided on non-incisional double eyelid surgery. It's also called the suture method, where instead of cutting the eyelid skin, they use a thread to create a new crease by stitching the eyelid internally. It lasts about 5 to 10 years depending on the person, and some people it lasts longer. I was put partially to sleep. I didn't feel any pain whatsoever, but the reason why they put you partially to sleep is because halfway through the procedure they ask you to open your eyes once or twice just to triple check that the crease is exactly where it should be. I woke up in this super nice and comfortable room. You are definitely going to be at least a little bit bruised and swollen on the first couple of days. I was looking a little bit crazy for sure. They give you some aftercare medication like antibiotics. You can't wear makeup for about a week after surgery, which I thought was like way less than what I originally thought it was going to be. Why did I do it? So although I technically already did have double eyelids, they were not super prominent and they were always changing, being uneven. Some days if I woke up more swollen, my crease would get super faint and even disappear. This eyelid especially was super misbehaved. Sometimes it would have like 2 separate creases, and I was just getting so tired of having to wake up and be like, okay, am I waking up today with good eyelids or bad eyelids? Generally, I just wanted to have a crease that was even on both sides, a little bit more prominent, and won't disappear on me. How did you decide on crease height? I asked for it to be the tiniest bit higher than my old crease, like literally 0.5 millimeter. You can see it kind of in the surgery mapping video. What about the pain? So I felt pretty much no pain throughout the entire process. The only time I really felt pain was when they put the IV in. That's like the pain of a needle. There's a little bit of tenderness on the eyelids after the surgery, of course, and you can especially feel it when you're applying the ointment. It's not pain, it's just like a little bit tender. Overall, I would rate the pain like a 1 out of 10. How much does it cost? I cannot share that because it is confidential. It depends on the person, but you can just reach out to them on WhatsApp and get a quote for yourself. They are opening a new location, so they are doing some promotions for that. This is how my eyelids are looking 3 months later. I got them done in March and now it is June. It takes about 6 months to a year to see the final results, but I already love how they look. I'm so happy I did it. They turned out exactly how I wanted them to.
I got double eyelid surgery actually twice in my life. If you're not Korean, you may not be familiar with double eyelid surgery. A lot of Koreans have monolids, which is basically when you don't have this crease right here. And a lot of Koreans will get 상가볼 수술 or double eyelid surgery. It's like very normal and common, to be honest, to kind of create this crease. First time it was actually after 8th grade graduation. I had always told my parents like, oh, I want to get it. Like, of course I want to get it. It was just like a thing. I got it done after 8th grade. We grew up in Naperville, Illinois, so we just like went somewhere local. They did it very, very, very natural. To be honest, it wasn't that noticeable. By the time I was a senior in high school, 4 years later, you couldn't even really tell. I'm gonna try to find a picture of how I looked in high school because I didn't think it was that noticeable. However, during the healing process, and because the technology back then was like probably not as good, I literally had stitches. Oh, I can't think about it right now. And I had to wear sunglasses, and I just like refused to stay home. My best friend, Colleen Costello, and her mom took me out like maybe 2 days after I got the surgery. We went to, I can't remember the name right now, but it was some kind of diner that has like shoelace French fries. We went to the diner and I'm still wearing my sunglasses. Colleen's mom, who was like so nice and like really took me into her family, was like, Jenny, why don't you take off your sunglasses? It's just us. So I took off my sunglasses, and I had told Colleen and Colleen's mom that I got surgery for astigmatism. Like, I don't even know why I lied. I think I was just like probably embarrassed to explain to a non-Korean person what this procedure was. And when I took off my sunglasses, they could see stitches on my eyes. So I'm sure they were like, this girl did not get surgery for astigmatism. Fast forward, all through high school, I was kind of like a while. I just went through my entire 20s knowing this is what I looked like. And of course, like during that time, I never really looked at myself like as much as I am right now in TikTok. I just thought like, this is my face. No one is even thinking about my double eyelids because this is just what I look like. And then I started making TikToks. And in particular, I made one video about 간장게장, which in Korean is marinated crab legs. I made a video and it got a significant amount of views, and it was specifically reaching a lot of Korean people. And Korean people can be rough. In the comments, it was all about my double eyelids. They were saying comments like, this girl's double eyelids look so botched. Oh my God, who did her double eyelids? She looks so bad. And that was the first time where I was like, oh, people can tell I look like I have double eyelids, and people think that they look bad. And then I started looking in the mirror and I was like, I guess they do look like a lot. Like, oh wow, like if you look at them, when I close my eyes, like you can tell. That's been like such an interesting journey where I'm like, I love how I look. I love myself now. And I've always loved my eyes because it's just my face. But after those comments, I did start to think like, wow, do I have botched double eyelids? Like, are other people looking at me and thinking, oh wow, she has botched double eyelids? I know this is like crazy to talk about on the internet because I don't want people to say, oh my God, why did you get it so young? You shouldn't have been allowed to do that. Or I also don't want people to say, why do Koreans even get double eyelids? Then recently I saw Chriselle Lim get double eyelid surgery and talk about it so openly. And I saw her after her procedure. I didn't see her literally, but I saw her videos where she was just showing off what her healing process looked like. Seeing her just get it done and kind of just like own it and own her beauty and own what she looks like, regardless of what people are saying about it on the internet. Like, it just made me feel healed and feel like I want to talk about it on the internet.
Then there's double eyelid surgery, which brings in a whole cultural layer. Some of these women had the procedure done in Korea, where it's common enough to barely register as unusual in certain circles. Some already had a natural crease and just wanted it more even, more defined, or less likely to vanish the moment they woke up puffy. Others were dealing with age-related sagging and wanted the excess skin gone while keeping their eye shape intact. This deserves more nuance than it usually gets online. People are quick to assume double eyelid surgery is about erasing ethnic features, but listen to the actual reasons these women gave. I already had a crease. It was just uneven. I had extra skin. I wanted my crease to match my face. I wanted it to look natural.
I got double eyelid surgery twice in Korea. 6 months ago, incisional, and 1.5 years ago, I got non-incisional. I am 6 months post-op, so I think these are my final results. I am very happy with my results. I'm gonna share my 6-month updates and answer my most asked questions. I did it twice because I did non-incisional first, and my right eye came undone after a few months, so I went back for incisional, which is more permanent. Non-incisional is known to be semi-permanent. I thought it would last longer for me, but my eyelid anatomy was just not compatible. Here's what my eyes look like looking down, closed, and looking at the camera. I always get asked where I went. I went to Wink Plastic Surgery and my surgeon was Dr. Choi. I have no affiliation. This is not promotional. I've never been paid to make videos for them, but I don't want to gatekeep either. I did my own research, so I would encourage you to do the same. Gotten questions asking about Dr. Kim at Wink Plastic Surgery. When I went, there was only Dr. Choi. Dr. Kim joined a few months later, I think, so I don't know anything about him. I think my scars healed really well. They don't feel thick. There's no itchiness. There's no discomfort. And like I said, I'm really happy with my results. In the beginning, I was a little worried because they did feel a little raised, but I was so religious with the silicone scar gel. I bought this at the clinic and I've been applying it religiously every night. At first, my eyelids were completely numb. I couldn't even feel my eyeliner. Sensation came back around 3 to 4 months, and now I can feel everything again. Healing was a lot longer and harder with incisional. Obviously, there's more swelling, more bruising. These stitches were really annoying. I think I was bruised for a good 2 weeks with incisional. With non-incisional, I was pretty much back to normal in 3 to 4 days. I never asked for a specific design or a specific millimeter height. I just asked for the most natural results for my eye shape. I didn't want to pick something that looked good on someone else but wouldn't match with my face, and I trusted him to know what would suit me. I got a tax refund for my plastic surgery and used to be able to do this in Korea, but I believe they stopped doing VAT refunds for cosmetic procedures in 2026. I stayed in Korea a total of 9 days. I landed on a Saturday, got my surgery on a Monday, and got my sutures removed a week later that Saturday. This worked out for me. It didn't interfere with any of my travels. I just wore glasses and sunglasses. There was no pain or anything. I just looked kind of silly, and they want you to walk after surgery to help with swelling. I saved all my skin treatments for that Saturday after my sutures were removed, and I just checked with my surgeon and my doctor to make sure everything was okay. I went to Korea because they know Asian eyes better and it's a lot more affordable. Non-incisional was around 800 to 900, and I believe incisional was 2,000 to 2,200, and it just depends on what is recommended to you. And I did have to wire a deposit beforehand. I did my consultation in person with Dr. Choi and did same-day surgery right after.
I got double eyelid surgery when I was in Korea, and I did not get it to look different. I have always had double eyelids. But as I've gotten older, I started to get a lot of saggy skin up here, so much so that I started having to raise my brows to open my eyes. So if you watch my recent videos, you'll see that I kind of talk like this because my brows were getting so tired and I was getting tension headaches because I had to raise them so much to open my eyes. And it is genetic, it just happens with age. My mom and my grandma had so much sagging skin it impaired their vision. I went in for a consultation for the suture method, which is not a surgery. They just kind of put like a thread in there to create a crease. And the doctor was like, I'm not doing that on you. That's not going to fix your problem. You already have a crease. So I did the incisional method, and he actually did it on my natural crease, but he just cut the extra skin. Because he did it on my natural crease, when the swelling goes down, I'm actually going to look exactly the same. He said the swelling will be 90% gone in about 1 month to 3 months, and then 100% gone in about 6 months.
Lower blepharoplasty surgery to remove my under eye bags about 4 weeks ago. Here is what I look like so far without any makeup on. Here are my thoughts about the surgery. In terms of any sort of side effects, so far I do not have any side effects. I have like no loss of vision. I have no dry eyes. I have like no sort of irritation or anything like that. The only thing I will say is that I do have a little bit of like under eye soreness still on this eye right here. Now during the surgery, it did seem like he spent a little bit more time on this eye than he did this eye. Speaking of which, my only critique thus far is that I feel as if there's still some fat or something left in this eye. I don't know if you guys can tell with me looking straight on, but this eye, particularly about like right here, still has a little bit more puffiness than this eye. Granted, I am 4 weeks out. I do not believe that this is swelling. I do believe that this is still fat or something in my eye. When I smile, you can definitely see it. Again, more so like some sort of like puffiness or fat or like something like right here than right here. So that's really like my biggest complaint. Another thing as well, with my surgery, I did not get a fat transfer, nor did I get like a fat repositioning. When I did research on this surgery, I did see where some other surgeons, they will do a fat transfer during the procedure, or they will do a fat repositioning during the procedure. And then some will also give you a skin pinch or CO2 laser. My doctor did none of those things. He said that during the surgery, he did not see that I needed to do a fat transfer or a fat repositioning. So obviously I did trust him on this. Even now, I kind of like don't feel like I need it. In terms of CO2 laser, he does offer CO2 laser, but because I am more melanated, CO2 laser is a bit more risky for people of color. So he just did not feel comfortable doing CO2 laser on me. That is something that I do plan on doing elsewhere, probably a little bit later down the line once I figure out this eye situation. It was a very quick, easy, simple procedure. I think the procedure cost me like $7,900. So like, you know, just very affordable in my opinion. Another thing is that I was awake during the procedure. I did get local anesthesia, which is basically means that he numbed my eye area. This was a scarless lower bleph as well. So he did the incision on literally like the inside of my eye, not the outside. So there is no scar. It took me about 2 weeks to heal. I did a lot during the healing process to heal, which really did help to speed up my healing process. Even now, I'm like very conscious of like what I do to like help myself, you know, even heal better.
There's a bigger conversation to have about beauty standards, sure, but that doesn't mean every individual choice collapses into the same explanation. One woman had the surgery young, lived with it happily for years, and then watched a comment section decide her results were botched. That's the cruelty of internet beauty culture in one sentence. You can be completely at peace with your face until a stranger's opinion convinces you to second guess it. Suddenly, you're wondering if everyone's been seeing you differently this whole time, which is exactly how social media manufactures insecurity out of nothing. Plenty of these women were simply happy with how it turned out too. Some had non-incisional procedures that later needed to be redone as incisional surgery once the crease relaxed. Some healed fast and easy. Others had a longer, more swollen recovery with the incisional method. There's no single story here. It comes down to anatomy, technique, surgeon skill, expectations, and how your particular body heals.
This is why it is almost always better to be more conservative with eyelid work than to be a little bit too aggressive, because our eye area is so sensitive that any small little thing can tip you easily over the edge into overdone. And in that overdone realm, because we depend on our eyes so much for everything, it can impact your quality of life in terms of constant dry eyes, like inability to close your eyes while you're sleeping, corneal tears, abrasions, eye infections, visual changes, etc. And so it's really, really, really important to, well, it's a couple things. Really important for one, the surgeon or the treater, injector, whoever in this case, I always try to make sure I communicate to the patients that I would rather us go slow with the eye area, and then maybe you don't get totally your result that you're looking for, but we can always come back and do a little bit more, as opposed to we overshoot it so much and now you're having permanent problems. The eye area is definitely one of those areas where you want to be cautious, proceed slowly, do your research, and have proper expectations of what truly can be addressed versus not without causing you any harm.
I am officially 6 weeks out of my upper blepharoplasty, aka my eyelid surgery that sent the whole world into a frenzy. And I wanted to check in, okay? This is what we're looking like. Okay, wait, this is without the beauty filter. You can still see the scar. I'm wearing scar cream every night. I think they say it takes like around like 6 months or something for it to be kind of like invisible, but it doesn't bother me at all right now. Like I feel like just looking at me, you can't really tell. You guys, I know you're gonna hate to hear it, but I'm so happy with it. Like I love it. I feel so much better. And I feel like I made this whole thing about how like the reason I got it is because I wanted to be able to wear like more eye makeup and like do my makeup more easily. And that's true, but after having it done, I randomly have felt so much better without makeup. It's like I feel like I don't have to wear a ton of makeup anymore, which is like literally the opposite effect of what I was going for, but I'm loving it.
Today I'm getting my upper eyelids done. If you take a look, I have a lot of extra skin. I'm excited to get it done. Come join me. Here we are, about 7 weeks post-procedure.
Get ready with me for bed. 4 days post-op, upper blepharoplasty, and a lower eyelid skin pinch. First, I carefully clean my lids with the lid scrub. I follow that up with a gentle cleanser on the rest of my face. Next, it is upper lid ointment time, followed by some Aquaphor for the lower lids, a sec to admire my handiwork, then moisturizer for the rest of the face, some gua sha. Last but not least, I put on my silicone neck patch and I'm ready for bed.
Something nobody tells you about getting a lower blepharoplasty is that your upper eyelids are going to change too. I had super hooded eyelids before my blepharoplasty. I'll attach a picture. And now, like by the evenings, they're pretty much straight. Well, I'm not totally mad about it. I just didn't really expect it. And sometimes I just feel like I look really different and it's like a big change all at once, but nobody in my life seems to notice, so I think it's really just a me thing. But
let's talk about what 6 weeks post mid facelift and blepharoplasty really look like.
I am 39 years old. I have 5 kids. One is 12 and the rest are 8 and under. I've had 4 kids in the last 8 years. I'm seeing a lot of laxicity in here. I was seeing a lot of depression under here, as well as really bad allergies. I would get like sinus balls. So they removed all of that. They removed my filler. He removed the skin up here. It was starting to kind of like droop over the line. My eyes look crazy still. They're very lifted right here. But if you look, they're not lifted right here. It's swelling underneath that's lifting the corners. So I also had filler in here for years. I had filler in here to try to lift the jowling. He took all of that out. When he went in here, he scraped all of it out. So all of this is swollen right now. Still very, very hard. With a traditional facelift, you're going to end up with scarring all down along your ear line. I have none of that. I'm not older. I'm only 39, so I didn't need the whole like shebang. I have no Botox. My forehead's fine. I have no wrinkles. So this is the only scar. This is the scar right now at 6 weeks. My profile is snatched. Super happy with this. I have 0 neckline. In 2 more weeks, I can go in with a CO2 laser, and I can laser here and here. Any texture or thickness to the scar or discoloration, it'll completely go away. The CO2 is also a healing period. So for anybody who's looking to see a result right now, it's not going to happen. The results for me are 2 months away, which I don't care. I'm patient. All of this right here in another 6, 8, 10 weeks will settle into place. This is not even my face shape.
The dry eye piece might be the most important thing in this whole conversation because most people only think about the cosmetic side, a more awake look, less puffiness, a cleaner crease. But eyelids have a job. They close. They keep the eye lubricated. They protect it while you sleep. take away too much skin, or let swelling interfere with closure, and recovery stops being purely cosmetic. One woman developed dry eye after an upper bleph simply because her eyes were swollen and tight while adjusting to less lid skin. She ended up needing punctal plugs just to stay comfortable. Another had it worse. Her eye wasn't closing all the way at night, and she'd wake up with burning, watering, redness, real pain. That's not a minor inconvenience. That's something that follows you into every part of your day, which is exactly why conservative work matters so much here. This is delicate real estate. A small change has an outsized effect. Someone in the video put it well, it's almost always safer to undercorrect than overcorrect. If the result feels too subtle, you can often go back and adjust. But if too much gets taken, you're now managing dry eyes, trouble closing your lids, irritation, possibly infection, or vision changes that follow you around long after the bruising fades. That's also why the surgeon matters as much as it does. A lot of these women specifically sought out an oculoplastic surgeon, someone whose whole specialty is the eye. That's not a knock on general plastic surgeons. It's just that when you're dealing with eyelids, tear ducts, fat pads, scar tissue, and actual vision, you want someone who treats the eye as more than a canvas.
So I had I felt like I had droopy eyelids, especially on this side.
Outer corner of the eyes, right?
Yeah, it was more like here on the outside.
So with this technique, as the incision is in the eyebrow, you can actually tackle this lateral hooding rather than the internal hooding. The traditional upper eyelid surgery, it does actually come and end in the crease here, so you can't deal with the excess skin on this corner. So the outer corners, saggy skin, you can see how tight the skin is there on the side. It is an amazing procedure.
I had an upper bleph on September 16th due to a lot of excess skin on my eyelids, basically a giant fat roll that caused a ton of issues for me. I jumped out there, made the appointment, and here I am 1 week post-op with some nice bruising, but still feeling very comfortable, absolutely no pain associated with this at all. And here I am 1 month post-op. I'm absolutely thrilled with my results.
I got an upper and lower blepharoplasty 2 weeks ago. I did have minimal under eye bags. I didn't have anything protruding outward, but I did have a slight dent. My upper eyelid would just cover up my eyeshadow and my eyeliner, which I always hated. The surgery was $10,000 for all 3 procedures. They had originally quoted me $15,000 to $17,000, but it just ended up coming out to $10,000. I thought the surgery itself was very easy. This is my 3rd surgery, so I have gotten a breast augmentation and a nose job. And if you've ever gotten those other surgeries, you know how much more invasive those can be. And this one was basically a walk in the park. And after a week, I was pretty much out and about, just wearing shades. The week after that, I was able to put on makeup. I did attach this video here. So I will say my only issue right now is that my under eye does have a shadow clear up in the next month or 3 months from now. Here too, you can see that my scar for my upper eyelid, the upper blepharoplasty, is kind of red, but with makeup, I mean, it just looks like bunched up concealer to me. Easily able to hide that up with some eyeshadow. Overall, I am just 2 weeks out. Surgeries like this take a few months to see the actual results. I'm so happy with what everything looks like as of right now.
Put all of this together and the takeaway isn't eyelid surgery good or eyelid surgery bad. It's about how much trust people are placing in procedures on one of the most sensitive parts of the body. Your eyes aren't just decoration. They're expressive, functional, the mechanism you use to see, blink, sleep, show emotion, and be recognized by the people who know you. That's exactly why blepharoplasty can feel so powerful when it works. People talk about looking awake for the first time in years, feeling fresher, finally being able to do makeup the way they wanted, or feeling confident bare-faced. For anyone dealing with genuinely hereditary under eye bags or lid skin no amount of skincare could touch, I get why the result feels life-changing. But none of that means it's a casual decision. Even a fast procedure can mean months of healing. Scars can stay pink longer than expected. One eye may outpace the other. Numbness can hang around for weeks. Dry eye can show up out of nowhere. Swelling can distort your face temporarily in ways that are genuinely upsetting to look at. Lower bleph results take time to settle, so do upper lids. What you assumed would be a minor tweak can turn into something surprisingly heavy to sit with. Something else that came up repeatedly, learning the difference between what surgery can actually fix and what it can't. A lower bleph might handle certain under eye bags, but it won't necessarily erase every hollow, shadow, or natural indentation. Some people are just built with deeper set eyes or features that will never look perfectly smooth no matter what's done. Some need fat repositioning, a skin pinch, laser, or some combination. Others aren't candidates for any of it. Which is exactly why a real consultation matters. You want a surgeon willing to tell you what's actually realistic, not just what you're hoping to hear.
Let me tell you how I found out the cause of my dry eye. It's really interesting. After my blepharoplasties initially back in July of 2022, the oculoplastic surgeon that did my blepharoplasties told me that I needed to use this stuff called Refresh PM. And that's that petroleum-based ointment that you have to use in your eye every night. And that's to prevent it from drying out. And they said it should be 2 weeks and then you won't need it anymore. After the 2-week mark, I started realizing that my eye, I would wake up and it was burning, watering to the point where I couldn't blink. It hurt so bad. It was bright red. So I started just using it again, thinking maybe it just needs another couple of weeks, and continue to use it. After I went to see the surgeon a couple of times and kept saying to him, you know, my eye is terrible at night. And in another picture, I'll try to show it. You could see where my lid on this eye was lower than this one. He kept saying, it's fine. I can see that you physically close it, but it wasn't staying closed. Here's how I found it. In October of 2022, I had to have foot surgery. So I had to be put under general anesthesia. And when I went, I gave the anesthesiologist this ointment and said, when you put me to sleep, can you put this in my eye because I have a lot of issues with dry eye. After I recovered, he came in and said, I know exactly why you have dry eye. And I said, what happened? And he said, you know how your eyes get taped closed when you're under anesthesia? And he said they had to double and triple tape this eye and it still wouldn't stay closed. So what was happening was that this eye remained open for, I forget how many centimeters he said, but enough that it would dry out my eye so it wasn't actually staying closed properly. With that information, I went back to my oculoplastic surgeon and I said, okay, so I got some validation that at night this is what happens. And he's like, it's fine. That's not really what I see at all happening. I'm like, but he actually witnessed this. When you are not blinking to keep your eye moist, your eye needs to stay completely closed to protect it from the air and things that can dry out your eye. So when your eye remains open like that throughout the whole night without blinking or anything, that's what's going to happen. You ever seen dry eye? Oh my gosh, it's so painful. And the irony is your eye actually waters excessively because it's trying to overcompensate for the dryness, and it is so painful and irritated.
Blepharoplasty complications. Chemosis. Have you ever seen someone with the whites of their eyes swollen? Sometimes an allergic reaction can cause the whites of your eyes to be swollen. It has to be diagnosed by a doctor, but it's called chemosis. 2. Blocked meibomian glands. Yes, something called meibomian gland. 80 tiny little oil glands right along the ridge of your eye. On your eyelid, the lower eyelid actually. Lower eyelid. They're actually oil producing. So when people get a sty in their eye, they think it's their tear duct. It is your oil gland, your meibomian gland. Meibomian gland. So after a blepharoplasty, you will need to keep your eyes lubricated as well as rinsed so you don't get blocked meibomian glands. Number 3, excessive swelling from too much eye movement. Shut your eyes. Check out. At least 48 hours. Cool gauze to your eyes, ice packs to your eyes. Make sure you have gauze so you don't get too cold. Resting your eyes is so important after a blepharoplasty.
Maybe the real lesson buried in all of this, your eye area is the worst possible place to chase perfection. It's not where you want an aggressive surgeon, and it's not where you want to walk in saying, just take it all. Overcorrecting here creates problems that are far harder to live with than a little puffiness or hooding ever was. Sometimes subtle is the win. Sometimes conservative is the smarter bet. Sometimes not dramatic. It is the thing that keeps your face looking like yours. There's a real emotional weight to all of this too. Eyes are one of the first things anyone notices about you. So if hooded lids or bags or an uneven crease have been bothering you, that shows up in how you feel in photos, on camera, in the mirror. But it cuts both ways. If you go through with it and the recovery scares you more than you expected, that hits your confidence just as hard. So be honest with yourself about the why. Is this something that's genuinely bothered you in daily life? Or did a camera, a comment section, or a trend talk you into fixating on it? Because social media has a real talent for making people notice flaws they used to never think about. Under eye bags become a flaw, hooding becomes a flaw, a natural crease becomes a flaw, the tiniest asymmetry becomes a flaw, and before long, people are trying to surgically smooth out completely normal variation in the human face. Not every shadow needs fixing. Not every eyelid needs lifting. Not everything that makes your face specifically yours needs to be sanded down into something more generic. None of this means people shouldn't get the surgery. If someone's done the research, found a genuinely qualified surgeon, understands the risks, and believes it'll help, that's their call to make. Adults get to make informed decisions about their own faces. The problem isn't that people are getting eyelid surgery. The problem is making a permanent or semi-permanent decision without understanding the healing, the risks, the anatomy, or the limits of what surgery can actually deliver. So maybe the healthiest way to think about blepharoplasty is this: it can be a genuinely great procedure with the right surgeon for the right reasons. But it's still surgery, it still carries risk, it still demands patience. And because it's your eyes, the margin for error is smaller than almost anywhere else on your body. Do the research. Get a second opinion, maybe a third. Ask whether you actually need an upper bleph, a lower bleph, fat repositioning, a skin pinch, laser, or nothing at all. Ask what happens if your eyes end up dry. Ask exactly how much skin or fat is coming out. Ask how long the scars realistically take to fade. Ask if you're even a good candidate. And ask what a realistic result looks like on your face, not the best photo from someone else's gallery. Because the goal was never a perfect eye shape. The goal is still looking like yourself, just more rested, more comfortable, and a little more at ease in your own face. So tell me, has eyelid surgery gotten too normalized online? Do you think people are actually honest about the recovery and the risks? And would you ever get an upper or lower bleph, or do you think we're starting to overcorrect completely normal features?